Have you ever noticed that as the years go by, your feet seem to complain more than they used to? For many people over the age of 60, foot pain becomes a frequent companion. But why does this happen? The feet are the foundation of the body. They carry us through thousands of steps every single day, from the time we learn to walk until we reach old age. By the time you turn 60, your feet have already endured a lifetime of impact, weight, and strain. As we age, the soft tissues in the feet lose elasticity. Fat pads under the heels and toes thin out. Joints become stiffer due to wear, and tear circulation slows down, making recovery from stress and injury more difficult. All of these changes combine to make the feet more vulnerable to pain, swelling, and fatigue. Foot pain is not just a small inconvenience. For older adults, it can reduce mobility, limit independence, and even increase the risk of falls. That's why in this video, we will explore the causes of foot pain in older adults, practical tips to relieve discomfort, and long-term solutions to keep your steps steady and confident after the age of 60. Foot pain after the age of 60 is not a random occurrence. It is often the result of specific conditions that develop over time. Let's break down some of the most common causes. 1. Plantar fasciitis. The plantar fascia is a thick band of tissue that connects your heel bone to your toes. When it becomes inflamed, each step feels like walking on sharp nails. This condition is especially common in people who stand or walk for long periods, and in those with flat feet too. Bunions hallux, valgus the big toe, begins to drift toward the other toes, causing the joint at its base to stick out. This creates pain, swelling, and difficulty finding comfortable shoes. Bunions are particularly common in older women who have worn narrow or high-heeled shoes. 3. Flat feet. The natural arch of the foot gradually collapses with age. Without that supportive arch, the entire foot bears more stress, leading to pain. An imbalance. 4. Arthritis. Osteoarthritis wears down the protective cartilage in the foot's joints, making movement stiff and painful. Rheumatoid arthritis can also deform the toes and cause chronic inflammation. 5. Diabetes. Complications. High blood sugar damages nerves and reduces blood flow. This leads to numbness, tingling, or wounds that heal poorly, a condition often referred to as diabetic foot. 6. Gout. Sudden sharp pain in the big toe joint, often at night, is a classic sign of gout. This happens when uric acid crystals build up inside the joint. Each of these conditions has different symptoms and treatments, but they all share one common outcome: limiting mobility and affecting quality of life. Asterisk, some people think it's just a bit of soreness. It will go away. But ignoring foot pain can have serious consequences. Loss of independence. If walking is painful, you might avoid leaving the house. This isolation can lead to depression and reduced quality of life. Increased fall risk. Foot pain alters your gait. You may limp, drag your feet, or shift your balance unnaturally, all of which increase the likelihood of tripping or falling. Chronic damage. Small issues, when left untreated, can worsen. A mild bunion can become severely deformed, or a minor heel pain can turn into chronic plantar fasciitis. Systemic health effects. Limited mobility leads to less exercise. This contributes to weight gain, cardiovascular problems, and even cognitive decline. So, foot pain is not just about the feet. It can impact your overall health and independence. Asterisk, while long-term strategies are important, sometimes you just want relief now. Here are practical methods to ease foot pain quickly. 1. Warm compresses or cold packs. Cold packs help reduce swelling and inflammation. Warm compresses relax stiff joints and muscles. 2. Gentle massage. Massaging the soles and arches stimulates circulation, eases tension, and reduces soreness. You can even roll a tennis ball under your foot while seated. 3. Supportive footwear switch. From thin slippers to cushioned shoes with arch support, the difference can be felt within minutes. 4. Over-the-counter inserts. Heel cups. Gel pads and arch supports reduce pressure on painful areas. These short-term fixes don't solve the root cause, but they give much-needed comfort and keep you moving. Asterisk, what you eat affects your feet more than you may realize. A balanced diet can reduce inflammation, strengthen bones, and improve circulation. 1. Foods that reduce inflammation. Fatty fish, like salmon and sardines. Nuts and seeds rich in omega-3 south. Fresh fruits and vegetables, especially berries and leafy greens. 2. Calcium and vitamin D milk, yogurt, tofu, and green vegetables. Build strong bones. Vitamin D from sunlight or supplements helps calcium absorption. 3. Hydration. Dehydration reduces joint lubrication, making stiffness worse. Drink enough water throughout the day. 4. Avoid trigger foods, sugary drinks, and processed snacks increase inflammation. For those with gout, reduce red meat, alcohol, and high-purine foods. A healthy diet doesn't just protect your heart and brain. It keeps your feet strong enough to carry you every day. Asterisk, short-term relief is helpful, but lasting solutions require consistent care. 1. Choosing the right footwear, flexible soles with cushioning. Wide toe boxes to prevent crowding. Low heels, around 2 to 3 centimeters. Breathable materials. 2. Supportive devices, heel cups for plantar fasciitis. Arch supports for flat feet. Toe separators for bunnis. 3. Physical therapy towel scrunches. Pull a towel toward you using only your toes. Heel raises. Rise onto your toes, then slowly lower down. Balance exercises. Stand on one leg with support if needed. 4. Gentle yoga, seated forward bends to stretch the calves. Downward dog to elongate the arches. Standing folds. 2. Increase circulation. 5. Medical treatment when necessary. Anti-inflammatory medication. Cortisone injections for severe pain. Surgery for advanced deformities, but only as a last resort. 6. Managing overall health, control diabetes, blood pressure, and body weight. A healthy body means healthier feet. 7. Regular exercise, walking, cycling, or gentle aerobics strengthen muscles and keep joints mobile. Consistency matters more than intensity. Asterisk, caring for your feet is not only about treatment, it's about daily habits. 1. Daily foot care, wash and dry carefully, especially between the toes. Moisturize to prevent cracked heels. Inspect for cuts, blisters, or infections. 2. Shoe hygiene, keep shoes clean and dry. Change socks daily. Replace worn-out shoes. 3. Safe movement at home. Avoid walking barefoot on slippery floors. Remove clutter and loose rugs. Install handrails in bathrooms. 4. Maintain a healthy weight. Every extra pound adds stress to the feet. Balanced eating helps reduce this burden. 5. Rest and recovery. Elevate your feet after walking. Soak in warm water with salt or ginger. Ensure good sleep for overall recovery. 6. Stay socially active. Joining group activities like Tai Chi, gardening, or walking with friends keeps you moving and motivated. 7. Listen to your feet. Pain, swelling, or numbness are warning signs. Don't ignore them. Seek medical advice promptly. Asterisk, we've covered a lot. Causes of foot pain, short-term relief, long-term care, nutrition, and lifestyle habits. Let's recap the essentials. Understand the cause: plantar fasciitis, bunions, flat feet, arthritis, diabetes, or gout. Relieve pain short-term with compresses, massage, and supportive footwear. Build long-term health with proper shoes. Physical therapy and medical guidance when needed. Support your feet with good nutrition, hydration, and weight control. Protect your feet daily with hygiene, safe environments, and regular checkups. Practical daily tips. Stretch your feet for 5 minutes before getting out of bed. Soak and moisturize your feet before sleeping. Choose comfort over style when buying shoes. Stay active at least 30 minutes a day. See a doctor if pain persists or worsens. Final message: your feet have carried you faithfully through life's journey. After 60, they deserve your care more than ever. Healthy feet are not just about comfort, they are about independence, confidence, and joy in your golden years. Take small steps today, and your future steps will be lighter, stronger, and happier.